Abercrombie, and I want to welcome you to the Autism Advisory Council for today. I don't even know the date. November 16th, Thursday. I want to thank you all for being here today. Any comments from my co-chairs? Gemma?
None at this time. Good morning, everybody. It's nice to see you all.
Great to see you. Yana?
Not at this time, but I will have something that I want to share later on.
Okay. Thank you,
And it's good
Yana.
to see everyone.
You too,
Great
Yana.
to see you. Great to see you.
Thank you for all your hard work to help the autism community.
Oh, you're welcome, honey. It's been my pleasure. We have a really tight agenda today, so I'd really like to get started. So first up is public comment. Is there anyone from the public that would like to speak at this time? If you could raise your hand, that would be great. Anyone from the public that would like to speak at this time? Okay, seeing none, unless anybody saw someone raising their hand that couldn't get on for some reason. I don't see any hands raised. So with that, we will move on to the next item, which I'm really excited. I'd like to introduce Dr. Sarah, and I hope I say this right, so please correct me if I don't. Schlegel.
Schlegel. Yeah, that rhymes with bagel. Yeah.
Okay. Oh, that's good to know. Now I'll think of that all the time. Sarah is joining us today because from the nomination committee, we have put her name forward as a member of the council and a pediatrician who works with children with autism. So I'd like to give Sarah the opportunity to just kind of introduce herself, why she wants to be on the council, and then I would open it up to any questions that anyone would like to ask Sarah. So with that, Sarah, thank you so much for agreeing to be part of this council and joining us today. And I will turn the floor over to you.
Great. Thank you so much, all of you, for having me. I was thrilled to actually discover the council, and that's really how it happened. Just to clarify, I am a developmental behavioral pediatrician at Connecticut Children's. I have been well, I'm a Connecticut native, so I've been in Connecticut pretty much my whole life, but I have been at Connecticut Children's for all of my professional career since my fellowship. I completed my fellowship at Yale in 2009 and came directly to Connecticut Children's. And I'm currently the division head of our developmental and behavioral pediatric program, or division, excuse me. There are 6 of us developmental behavioral pediatricians in the division, and there are 2 advanced practice providers serving way bigger need than we can serve alone. Certainly, we're trying. You know, we often feel like we're drowning, and we just can't serve everybody that we need to. The majority of our patients are certainly patients with autism spectrum disorders. We serve children from ages generally about 1. We don't do the infant, those younger children, but developmentally, we serve kids 1 to age 26 is really when they would age out. Specifically, I run our division's transition to adulthood with developmental services program I started 3 years ago, just over 3 years ago now, that is really dedicated to individuals who are 14 is generally when they start high school, and they can stay with me through 26, as I mentioned, and we do transition work, right? Transition to adulthood. And in developmental behavioral pediatrics, that is transitioning into the community, out of the school or through the school transition programming out of, into the adult world, and accessing services. And a enormous challenge I have is certainly, as I said, the large population of patients I have who have autism, who we really struggle to access services, as adults. So when this group came under my radar, I think I was Googling something and found that you all meet. And I said, oh my goodness, I need to be a part of this. And then like the thing that just astounded me was I looked through the list of the participants, and there was a blank opening for a question. I said, well, this feels natural. So I reached out to Anne Jeanette, because we'd worked together in a previous group, and I said, help, can I get involved? So that is how and why I'm here, and I'm happy to answer any questions. Hopefully I didn't take too much time. I know you have a large.
No. We wanted the group to get to know you. So your presentation on who you are was perfect.
Oh,
And I just want to really say thank you for volunteering to be part of this group and the expertise that you bring to this group. With that, I'll open it up to any questions from our colleagues here.
Thank you.
Hi, Sarah.
Mariana.
I am so excited. We have somebody who is actually stepping up to the plate on her own, and we're not having to strong arm and reach out. That's wonderful. I think at some point we worked together on a project. Can you tell us a little bit about some of the projects you've done with Anne, and maybe perhaps for the state of Connecticut?
Sure. Well, I have to say, Anne and I worked together a long time ago. Actually, it was probably around 2009, 10, 11. I think we were working on an autism related project. And I was such a new attendant, and just gotten into the work. And forgive me, I can't remember the entire gist. I'd have to go back and look it up, but we were working with the Medical Home Initiative. And Anne, you can correct me if I'm wrong, if I think that's what it was. I work very closely with the Medical Home Initiative, specifically the team. Well, I refer patients all over the state, but I work with the team here at Connecticut Children's very closely. Again, but I'm not involved in the grant anymore. That was a grant that we were working on at that time. In terms of state programs, I don't have a lot of programs that I'm directly involved with state agencies. Again, I work a lot with state agencies in my clinical work and referring patients and interacting in that way, but I don't sit, unfortunately, in any direct committees or anything like that. Yeah, nothing directly for the state. I mean, I serve the state in lots of ways, but not any official state committees. Mm-hmm.
And Doriana, it was the same grant that you guys were involved with. It was that autism specific grant that was time limited, and we had a number of different partners. And we also worked with the training piece that she did for the ASAP program, the as soon as possible transition, a triaging program to get people in, young children in for diagnosis.
Thank you, Anne.
autism.
I couldn't remember.
Yeah.
That was, I mean, I remember doing all that.
And you
work.
did the
I couldn't remember
trainings,
what was
yes.
with the, and that's right. And we did the trainings with the Medical Home Initiative, and I do
Right.
remember that too. Yep. Thank you.
And Doriana was involved too. And there's like a lot of grants we have, there's a lot of moving parts to them. So
that's right. And
Lois
again,
was involved in her organization. We tried to really connect a number of dots. So,
and I probably didn't even understand the depth because I was, again, a fledgling provider, and I was just like kind of thrown in, which was great, but I didn't even know kind of who I was connecting with at times.
You were very, flexible. We talked to you about what we needed. You designed a program piece. You went out and did it. We modified it based upon the audience need. And I shared some of that information with the group, how I just found you very responsive and thinking about consumers as your real end focus in figuring out how to do that. And we did those trainings and kind of aligned them with our Connecticut Medical Initiative sites that we had.
That's right. Thank you.
Great job, ladies. Anyone else with a question or a comment?
I have one. Hi, Dr. Schlegel. My name is Jenna Miller, and I'm a co-chair and also a parent of a child with autism. I wanted to know if you had any sense of the patients that you see, how much of them are using state services and how many of them are on commercial or self-pay. And I don't know if you have that at your fingertips, but just as you're coming onto the council, I think that I've been on my employer's commercial, benefits and insurance. Right now, my son is on Husky. And I've just seen there's a lot of change. There's a lot of that's different based upon that sort of a situation. And I just didn't know coming onto the council if you have any insight into percentages or just how much are parents paying out of pocket, I guess is what I'd want to know. And how much, are we able to actually do at the state level for these types of services that you're offering at the developmental?
Right. So my program, so Connecticut Children's, sees patients of all insurances, and, certainly we have to accept all insurances. We typically in developmental behavioral pediatrics, and I think it's reflective again around the institution more or less, but we are about 55% state insurance and about 45% private insurance. And we take everybody, and we don't look at insurance. I mean, well, somebody does, but, coming in, they are referred to us, and we just, see them regardless. So there's no, determination based on insurance, whether or not we would see them. Unfortunately, that's not the case in, all over Connecticut. If there are other, private developmental behavioral pediatrics, they may not take insurance, or they may, so that's one thing, developmental behavioral pediatrics. However, knowing that kind of range or those statistics, our patients go all over the state to receive services, right? So, I mean, they see us and they're covered, and that's one thing. But then, when they're getting their actual day-to-day services, and, of course, I can't give you an exact statistic, but it's probably 98% of our patients are in the public schools if they're of school age, so, I mean, they're getting state services that way, and that's obviously not insurance-based. When we talk about, the big thing, ABA, right? That's a challenge always to get kids in. We were thrilled when, a couple of years ago, the state changed and said, yes, we will provide ABA for kids. I am thrilled about that change. However, we have not been able to keep up with that demand. Not me. We don't provide that, but I'm saying that has been our biggest challenge. Every day, patients come in and we see them and they say, we want ABA and we've been approved, but we're on a wait list, and we're on this wait list, we're on this wait list. And so I think there's a lot that we can do, from this advocacy perspective. I mean, I love that, it was a big change to make sure that these kids could get this service. And that has changed my world, my patient's world. But now we're on to the next step of saying, yes, it's nice to say we can do it, but we need to have the action, so I think, that's a big thing. I also, feel very strongly about services for young adults and into adulthood. I think we can advocate for services at that level too, because that is where I sadly see a lot of the challenge as well. It's not an insurance issue. It's that it's not being, they just don't have an access point. With DDS is the big example that they don't have, they're not able to access it as adults because it's not available, and so again, I know you asked about insurance, but I kind of answer about advocacy. So a couple different avenues.
I really appreciate your thoughts on that. And I just, for the committee, it's just, I think for the council, I think it's helpful for us to just kind of get in a nutshell, your worldview on your day-to-day.
Sure. And I'm happy to bring in, my colleagues to, bring them in, represent them, again, I'm telling you what I see, but I think it's very representative across developmental behavioral pediatrics in Connecticut. And just to let you all know, we are pretty much the developmental behavioral pediatricians in Connecticut. As I alluded to, there's a few private, people here and there, but we really serve the state at this point, and there's just not enough. So anything we can do to advocate for our patients, we're trying,
Excellent. Super appreciate
Thank you. Thank you so much.
Thank you, Gemma. Great questions. And you're going to be an excellent asset to this council, Sarah. So thank you for that. Jim?
Thank you, Representative Abercrombie. Dr. Slagle, it's great to have you here. It's great to have somebody in your position participate with the council. I just wanted to ask you about an area that's long been a challenge, and that is the transition for people with autism, the transition from pediatric healthcare to adult healthcare. Are you seeing that get better? Are you seeing that get worse? Are you finding resources as far as adult medical providers who can work effectively with folks with autism?
That's a great question. And I have to say hello to you because it's been a really long time since I've seen you. I've sat through some of your workshops and I don't know if you'd remember me, but we have met before. Goodness, I don't know. That's a tough question. And I'm just because there's so many variables.
It's a problem that's been for so long. You're kind of at the forefront of that. I'm wondering if you're seeing changes.
We see, of course, there is no corollary for developmental behavioral pediatrics. So they don't have some specialty care in the same way. We're really transitioning them to general providers for their general care, which they would transition from their general pediatrician as well. And then of course, if they need specialized, if they have any other, like any other adult, if they have any other current medical problems, then they would, see a specialist. I think it's challenging to find people, and I'm just going to even make it a more global answer. It's challenging to find adult providers who serve individuals with developmental disabilities. So I wouldn't even say it's just autism specific. And I often will defer to my colleagues who are in whatever that field, say it's neurology, so a pediatric neurologist who would they recommend this individual works with, and it's often dependent on where the patient lives, and what kind of services they have. Fortunately, I think our state, being the size, the nice, somewhat manageable size that it is, we can sometimes, especially for kids with complex medical problems, refer them to a center, somewhere like Hartford Hospital or St. Francis, or depending on where they are, so sometimes that's helpful. But it is a challenge finding adult providers who are familiar, generalists who are familiar with the services. And again, that's where most of my patients need. It's not so much the medical services. I mean, some have some complex medical needs, but the majority of them really have just your kind of general healthcare needs, but really outside services. So yeah, I guess the short answer is I'm not sure it's much better, but we're working harder to find people who will be, friendly to developmental disabilities, or friendlier. So yeah.
Thanks.
Yeah. Of course.
Thank you, Jim. Any other questions or comments? Well, seeing none, what we would like to do at this point is, Sarah, we're going to put your name forward for a vote, even though, because you were nominated from the subcommittee, we just want to make sure that the whole council has a voice here. So with that, I'll entertain a motion to accept Sarah Slagle as a member of this council. Can I have a motion?
So moved.
Moved by Lynn Rickey. Can I have a second?
Second.
Second by Marcia. Thank you. Any questions or comments? Seeing none, all those in favor, please say aye. Unmute yourself.
Aye.
Aye.
Hi.
Any nays? Seeing none, welcome, Sarah. Congratulations. We're so lucky to have you. We're excited.
Thank you very much, everyone.
We're
I
so
appreciate
excited
it.
to see you. So please, I hope that you can stay on for the rest of the agenda today.
Absolutely.
And then we will go from there. So thank you so much for volunteering to be part of this group. And we will definitely appreciate your level of information and expertise to this council. So thank you for that.
Thank you so much.
You're welcome. Moving on to the next item, we have Jen Crone, who is going to just give us an update from Beacon. Good morning, Jen.
Hi, everybody. Thank you, Representative Abercrombie. Dr. Schlegel, I'm especially excited to be able to connect with you and have my care coordinators from the Beacon Health Options Autism team connect with you. I know we do receive probably the bulk of our autism diagnostic evaluations from your group. So if we can connect to better help with the connection into services, I know my team would appreciate that.
Definitely. And good to see you again, too. I know we've talked before. So,
Yes.
Good.
Okay, let me go ahead and share my screen. Okay. So I'm here today to share our November data update for our state plan services for individuals with autism, and nothing's advancing. So we continue to see a growth that we've seen throughout our services, especially within the past few years with the onset of COVID. I think we had a really large influx of individuals accessing our services. While some of the services were put on hold during portions of COVID due to quarantine, we have seen all of those numbers kind of resume back to their regular increase in accessing authorizations. So here you'll see the green line, that's our treatment plan development and program book development authorization. That continues to be our highest number of authorized services, as that is a service that can be authorized multiple times throughout an individual's time within a provider. We offer that every 90 days or as needed if behaviors change, if they feel that they need to do a reassessment for behaviors and modify a treatment plan, and then the subsequent program book that's part of it. Followed closely behind the behavior assessment, the gray line, which also is available to individuals on a regular basis. Again, as behaviors might change, as new behaviors might arise. I think we saw an influx of individuals accessing that as things began to reopen after COVID and behaviors really changed. We also offer that to our providers upon discharge from a higher level of care. So if an individual went into the emergency room or had an inpatient stay, we offer that as part of the transition back to home so that they can go to that location. Lynn Rickey knows this from her team. A lot of our providers will go to her facility, the Hospital for Special Care, and work with the team there to collaborate and develop new treatment plan goals based on what has been seen at the inpatient level. Our group treatment services, the yellow line on the bottom, continues to be our lowest access to authorization. However, that has actually grown considerably post-COVID, as a lot of our providers recognize the need to really support our individuals with autism in reintegrating into group settings, whether that's school or play settings or anything like that. Here you see just a different overview of our authorizations and how they continue to increase. The diagnostic evaluation, we are up to 447 individuals who are accessing that diagnostic evaluation currently. That's up 27 from last month. We have 3,973 individuals actively receiving services, whether that's in home, in a clinic setting, a combination of that. Some of our providers are also still providing a hybrid model of telehealth services and in-home services based on the needs of the family and how to best support the individual. And then we currently have 117 individuals who are accessing that group treatment services. Those are typically delivered in a clinic or center-based setting. Our providers do keep those groups quite small. So while we are able to allow up to 8 individuals in the group setting, typically the groups remain around 3 to 4 individuals, so they can really work on generalizing social skills in a small group setting to individuals who have similar goals. Here we look at the age of admissions. So admissions in this world, and our definition of admissions is individuals as they begin our services and have their first authorization with the autism services within the state plan. So no surprise, our highest influx of individuals are those 3-year-olds as they're exiting birth to 3 services. We did see an increase in 1 and 2-year-olds during COVID coming to state plan services as we were supporting individuals who really needed that in-person touch for services, where the birth to 3 services during the height of COVID really were telehealth delivered. So we still continue with a few of those individuals, but the majority of those thankfully have transitioned to the post birth to 3 services with us in Medicaid. So it's exciting to see those itty bitties getting services and getting connected across the board to any of the services. As we all know, early diagnosis and treatment is a better prognosis for those individuals. Here we look at our demographics, which stay pretty steady each month that we look at them. As we routinely see that unknown bucket, which is based on how individuals identify their race or ethnicity when they become eligible for DSS. It is not a required field for them to fill out. So it does come over to us as an unknown bucket. That's 30.92%. Hispanic individuals, we have 27.54%. White, we have 24.54%, and Black, 11.93%. We continue to see a steady, our largest group of people are not DCF involved at all. So that's 93.86%. We do have 7.23% who are either involved in a DCF investigation with their CPS team or DCF committed. And then a very small group of individuals, 0.08%, who are also working with the Beacon Health Options Voluntary Care Management Program. Part of their disqualifying criteria is an autism diagnosis. So the individuals that 0.08% also have other mental health diagnosis in addition to autism, and therefore can be receiving services from both of our groups of voluntary care management, which is typically therapeutic support staff, as well as the in-home ABA services that we're able to authorize. When those do overlap, it's for short periods of time, and typically to be able to better support a high needs, very complex individual or family. So there's a higher staffing ratio in the home. Region 4, which is our DCF area office, Hartford and Manchester, continues to be one of our highest recipients of services. It's also one of our more saturated areas of the state, where we have the lowest number in our Region 3, which is along the Rhode Island border. So while it is the lowest number of individuals looking for services, it's also the area of the state where we have the longest wait times, as we also have fewer providers in that area of the state. Here we look at our provider enrollment. We're so excited that this continues to increase. Over this past month, we've added 10 more individual providers so that we're up to 856 providers able to deliver the direct service delivery. So these are the providers who complete the treatment plan, complete the behavior assessment, develop the treatment plan, and then oversee the ongoing services. So those are our board certified behavior analysts or our licensed clinicians who are qualified by Beacon Health Options to be able to work with this population and enrolled in Medicaid. We have 181 practices, so that could be an individual practice or a group practice. So the 856 make up that group agency practice. The majority of our providers are the BCBAs, followed closely by a combination of BCBAs and licensed clinicians. Our care coordinators work to connect families if there are other mental health needs within either the family or the child. We do try to connect them with an agency who also has licensed clinicians in addition to the BCBA, just so that those mental health needs can also be addressed within that care. Here we look at the activities of our peer specialists and care coordinators. They remain quite busy all of the time. They really are the boots on the ground. I know, Dr. Schlegel, they're probably who your team hears from the majority of the time as they're working to connect families with services. So our top two bars here, we have 52 individuals who have been referred to a provider and are actively on their wait list right now. Our providers maintain their own wait lists. So we are aware of wait lists when providers are reaching out to us to say, hey, we're looking for new referrals. It's about a 2 to 3 week wait, or whatever their wait times are, they report that directly to us. We have another 36 individuals who are working to identify a provider. So that could be a combination of our care coordinators reaching out to providers with a family. That could be some families reaching out directly to providers themselves. Our care coordinators and peer specialists do help families develop questions in order to be able to kind of interview providers in order to make sure that it's a good fit for the family. So, some of our families, it's really important that services can happen both in a center or in the home in order to be able to have some time that they're generalizing behaviors to us, other environments, whereas other families want all services in the home or all in a center based setting. So we're able to help connect our families with providers that can meet those needs. We have 97 individuals who are actively working with their care coordinator and peer specialist to gather needed information in order to be eligible for the autism services. So that might be the diagnostic evaluation that was done outside of our state plan service authorization structure. That could be waiting for a supporting letter from a current treating provider if that diagnostic evaluation was done more than 3 years ago. That could also be releases of information so that we're able to connect families directly with providers. We have 13 individuals who are working with our care coordinators who are currently in a higher level of care. So typically an inpatient setting that we're working to connect with a provider post-discharge from that higher level of care. And then we have other various buckets that we're supporting individuals as they're transitioning from different services over to the state plan services. And our peer specialists and our care coordinators stay with them the entire time that they're involved in those services. Dr. Schlegel, just so that you're aware too, our care coordinators and peer specialists are able to support anybody on Husky, regardless if they already have the diagnosis of autism. Our authorizations can only be for individuals up to the age of 21 and on Husky A, C, or D. Are there any questions? Okay, thank you.
I had a.
Hi, Dr. Loomis.
Hi. Thank you again for kind of very thorough presentation. When you were here in July, we were talking about outcomes and sort of the need to really look at, are kids getting better? What kinds of behavioral outcomes are we seeing? What kinds of school function, whatever. And you said you were going to be meeting in September. In fact, there was a new person coming in who kind of specializes in more outcome kind of research. And I just wondered if you could update us. Has there been any thought or discussion of looking at outcomes?
Yeah, so it's actually something Bill Halsey and our other state partners, we continue to talk about in our regular meetings in how to measure outcomes that would be based on authorizations and true data versus reports through our providers. So we have the same challenge when gathering data about wait list times, right? So right now it's a verbal manual output, right? So we are still working with our data team to be able to develop a way to be able to actually pull that through our authorization and claims system so that it's true data. I think within our own team at Beacon, we're also working to define what does that mean when somebody with autism gets better? What does that look like? Does that mean that they don't have emergency room visits? Does that mean that they don't have inpatient stays? Does that mean that their hours are decreasing over time for the in-home services? Are they switching from more decreasing problem behaviors to skill acquisition, and how can we measure that, right? Because to me, those are all ways that somebody is getting better within their autism diagnosis. All of those things are difficult to measure through our system. While our system is very sophisticated, there are limitations to what we're able to gather. So we are continuing to have those discussions within those smaller monthly meetings that we have. Our team currently is also working on maybe not outcome-based, but connections with providers. We're working on, this has been a huge manual lift for our team to reach out to all of our 856 providers to find out if they speak other languages, if they work with other diagnoses, if a child has autism and something else, what's their specialties, if they're providing services solely center-based or solely in-home, what that looks like so that we can actually update how we present that information on our public website, so that families would eventually be able to filter on if they're Spanish speaking or Russian speaking or whatever, what their language needs are. They would be able to filter on that and see what providers use their language and what areas of the state they're servicing. So we're hoping to make that a little bit of an easier process for families as well. So again, maybe not outcome based, but if they can get connected to services faster, the outcomes obviously are better there as well.
Thank you.
Yeah.
Good question, Jim. Leading into the direction of talking about data collection, on our agenda, a few items down, we did have that we were going to ask Guy Wilston, who is our new Medicaid director for DSS, to come and present about his thoughts about data collection. Guy, did I say his name wrong originally? I'm sorry. Guy is actually at a Medicaid conference this week. So he was not able to join us, but he did say that he would be more than happy to come to a future meeting and to talk about this. And then the other piece of that, which I always like to toot Connecticut's horn when I get the opportunity, the new director of Medicaid for the association was nominated last week, and that is actually Kate McAvoy, who was Connecticut's Medicaid director for many years. So I just want to give a shout out to Kate. I think that we all should be really proud of the fact that we have so many people from Connecticut that have gotten these positions, either in DC as commissioners, which we've had, 2 from Connecticut appointed, and now Kate, who will be the new director of Medicaid for the National Association. So kudos to Kate. And again, Guy said that he will come to a future meeting and just talk about, your thoughts on what data collection should look like, right? And how do we measure that? And I think Jen's right. It's not an easy tool, especially in Medicaid and especially in different populations. So thank you, Jen, for that. Any other questions for Jen? Oh, hi, Carrie.
Hi, Carrie.
Hi, Kathy. So this is not specific. I mean, it does sort of come off of what Jen has just shared. Thank you for always providing such detailed information for us. But I think, so it's not specific to you, but I do think it logically follows. One of the things that I think we have discussed on multiple occasions here before, and it just sort of, comes back to me when we're talking about the service provisions available to our population, particularly at, this council is focused on individuals with autism without intellectual disabilities and so forth. When we're talking about the waiver and other services. It sounds like the vast majority of available services to this sort of subgroup, right, are ABA. And then there are also, I know when you're talking about licensed clinicians, Jen, or I imagine I should say that you're talking about counselors, psychologists, and others. But and I'm obviously speaking from a biased perspective, or multiple biased perspectives. One being as a mom of a kid who fits into this subgroup, and 2 as a psychologist. I see that there is a group of individuals who don't necessarily want or need the ABA services first and foremost.
Mm-hmm.
And I bring this back to this council because I think we ought to really pointedly address as much as we possibly can, the dearth of providers that exist for this population, and really actively seek to advocate for and expand that group of providers so that our folks do have ample resources available to them. I know that I'm preaching to the choir. I know this is on everyone's mind, but I want it on here for the record, because sometimes our folks go the ABA route, and this is no offense to my ABA colleagues, and it's not what they necessarily need first and foremost.
Mm-hmm.
It may be a secondary need. It may not be a need at all. So I just want to caution us against that being the default, and then mental health needs or other service needs being secondary to that. So for what it's worth, that's more of a comment than a question.
Yeah, thank you, Carrie. So part of that is, we absolutely see that too. And I think definitely with our higher functioning individuals or individuals kind of preteen age where, ABA really might not be appropriate for them. We do, because in the Medicaid structure, we are able to have both the BCBAs and licensed clinicians provide the in-home ABA services. We also have a large group of licensed clinicians who we happen to know are well educated in autism, and if they are also enrolled as an outpatient therapist within Medicaid, can provide more traditional counseling services, whether that's individual therapy or family therapy. Sometimes that's more needed or more relevant for our individuals. It also really, we specifically connect families with the licensed clinicians when they are discharging from a higher level of care, just because of all of the things that happen while you're also discharging from a higher level of care, not just ABA needs, right? So that's within the Medicaid structure. Our care coordinators also work really hard within their community that they're assigned to find other equine therapy, aquatics therapy, social groups, all of those other things that might not be Medicaid reimbursable, but could be beneficial for an individual, and also work with some of our community groups to be able to find grants so that families can access those things even when they don't have the financial means to do that.
Can I
Yeah.
ask one quick follow-up
Sure.
question? I'm sorry, because I imagine that a number of us on this council, because of the spaces we occupy, are frequently asked for resources, referrals, et cetera. And I find personally that within my, the people that I can kind of reach out and touch, that folks are at max capacity, they have full caseloads, et cetera. So if there are ways that we can share, obviously with permission, that we can share resources with folks, that would be extremely helpful if we could circulate that among the group.
Yeah, I absolutely agree.
Yeah, thank you, Carrie. You make a really good point, because even as, an elected official, I get numerous calls, and just like you, it breaks my heart that I, say to them, I don't have an easy solution for you. I wish I did,
Right.
and I wish I had a magic wand that said those services are right there at your fingertips. So I think we all agree that it's a really, it's a tough situation in the workforce, right? We talk about healthcare in general. This is one piece of that there's also a lack of workforce, which is something that this group could actually talk about and try and think about, how do we enhance the workforce going forward, right? And I know Jim has been on this for many, many years, about the provider network, and how people are getting older, like myself, that are retiring, you know what I mean? And what does that look like for the future? So I agree. So thank you, Carrie, for raising that issue. It's really important. Lynn, Ricky?
Thank you. Yeah, I think Jen clarified it. Carrie, I was just gonna ask a clarifying question. You're talking about individuals who don't have an intellectual disability co-occurring. Okay. Thank you.
Yes.
And then second, just it's not a huge resource, but it is a resource. We do have a therapeutic riding program associated with the hospital. And we actually got a grant through the Doug Flutie Foundation to specifically focus on individuals with autism, and are going for another one. So the program is called Mains and Motions. If that can be a resource to anybody, we certainly do see both children and adults with autism, and they're skilled at being able to provide that level of service. So just a comment. Thank you.
Carrie,
That's
too,
great.
and this goes for everybody in this group too. We all get peppered with those questions, or whether it's your family, your friends, your neighbor, whoever, asking if they know you work with autism, in the population of autism, we're asking for support and resources. If they are on Medicaid, regardless of their age or Medicaid beneficiary package, you can get them over to our team, and somebody will be assigned to do exactly that digging. That everybody has different needs within the autism communities. So we're happy to support connecting them with anything. It doesn't need to be the behavioral support services in the home.
Yeah, thank you. Thank you, Lynn, also for the Mains to Motion.
Yeah,
I think that's awesome. Yeah, what a great resource. Sarah?
There we go. I just had a quick question for you, Jen. If you have the number of providers who are able to make the diagnosis, who are approved diagnosticians. I know we're talking about service delivery, but I will tell you from my perspective, as I gave you the numbers of how many providers we have, dedicated to doing the diagnostic work, our wait list is astronomical. And so this number, the numbers you're showing are not even representing, as you are, I'm sure, well aware, the number of kids who actually we suspect will ultimately need these services. So I'm just curious what kind of numbers, because from my count, it's pretty low, in the state of people who can do this diagnostic work. But that's another bottleneck as we're trying to get kids into services. So what numbers?
So I don't routinely report out on that number. I can filter our reports in order to be able to tell you the number of individuals who only do the diagnostic evaluation. We do have some providers who do the diagnostic evaluation and subsequent services. What we typically see within our authorization system at Beacon is that the larger entities like CCMC or Yale have much more extensive wait lists. We do have quite a few, mom and pop or individual providers who also very excited speak other languages and can do the diagnostic evaluation in other languages. Their wait times are not as extensive. For the smaller groups that we refer kids to, we can sometimes get them in within 2 to 3 weeks of a referral. That does depend on where they are in the state and if they're able to travel to where the location is. I think sometimes that's why, CCMC or Yale might be easier for some families because they are very much located on a bus line or easier to get to for our families who might not otherwise have transportation. But I'll look to include that information going forward.
Thank you so much.
You're welcome.
Thank you, Sarah. That was an excellent question, comment. One of the things to think about for this council going forward also, I always talk about, legislation going into the next session. Is there a provider or clinician out there that would be qualified to do some of these diagnoses, right, that we don't include them to be able to, they're not authorized to be able to do these diagnoses, and that might be something that might have to be changed with a license through DPH. But that's something for this group to think about going forward, because listen, I'll tell you, I've been on this council for 16 years now, and it's the same issue that we had 16 years ago, right? That there aren't enough clinicians out there qualified, with the diagnosis portion of it, right? Which holds up the whole line of the treatment plan, we know, and everything else. So that might be something for you guys to think about going into the future. Is there some license changes? And, you're very fortunate because you have Ann on this group from DPH who, she's been on this well over 10 years, Ann, I want to say. And so, right. Yeah. So, she might be very helpful in that, but I think it's something for, you guys to look at going into the future. Lynn?
So I was just going to comment, I think there's the organizations that have the clinics, I'll use the term for, or the available providers to do the assessment. I do think it's a little more challenging getting a Medicaid child or individual an assessment. The wait time seems to be more extraordinary. But the other thing I would comment on is that many years ago, there was a change in allowing psych techs to do some work with regard to evaluations under the direction of a licensed psychologist. And we have piloted that. Actually, it was one of our clinicians who was part of spearheading that, not related to autism in our neuropsych area, but we have actually hired one and are piloting that. And I have to say, it is yielding some really great results in terms of knocking down some of the wait times for adults who have, and children who have brain injury or neurologic or neurodiagnostic questions to be answered, because we're able to, it's not as easy to hire a PhD psychologist. The psych tech role is more available. So I'm hopeful that is something that we could expand across other programs that might allow more access, particularly for individuals with Medicaid, which, as everyone knows, is the largest group that we see. So.
Yeah, that's great, Lynn. And Ann, are you aware, of this pilot program that's going on? at, with Lynn Rickey at the Hospital for Special Care? And is this something that perhaps DPH has already been considering or looking into?
I would be happy to talk to Lynn more about
Sure.
that specifically. I am aware that there is going to be some new access available for families who have children who have a different or alternate immigrant status to be able to access Husky A and Husky B starting in January. There's going to be a new release of information for access to that insurance plan. But yeah, we are happy to talk about these options, and I would have any other experts weigh in as well. Possibly a team is the best way to do it, but specifically what Lynn is talking about, I do not have the details on. So
I can reach out, Ann.
absolutely.
Okay,
Yeah,
great.
thank you to both Lynn and Ann. I think that's a great, a great connection that this council could make, right? Because we've got the agencies here and they get to hear it, in person about what's going on. So Lynn, yeah, that'd be great if you and Ann could get together and kind of have a conversation. And then from there, Ann, if you think that there needs to be a bill introduced in public health, we can make that happen.
Sure.
But that time is not our friend because the session starts the first week of January. And the new legislature really only has like 2 weeks to get these bills out. So, I think it would be great if maybe there could be some movement on there. So thank you to both of you. Mike from DSS.
Any discussion that you're going to have about the evaluations and what evaluations and who's doing them, I would suggest involving DDS in that discussion, as they still do all of our eligibility and what evaluations they're willing to accept or are looking for.
Thanks, Mike.
That's a good point, Mike, because I think a lot of times we might have a family who has a questionnaire that was completed, but we know that once they're going for further DDS eligibility, that they're going to require further testing and IEP and all of the other documentation. So our team works really hard to set them up for success when they go for that DDS eligibility. So I think that's part of the caveat to those wait times, is we also know what the long-term need is going to be.
So
Thanks, Mike. Good point.
So I guess the question is over to Krista from Oshashevsky. Good morning, Krista. So nice to have you here. Do you do the licensing of these clinicians, or does the licensing still go through DPH?
Good morning, everyone. Good morning, Representative. Nice to see everyone. I was a few minutes late to this meeting, so I apologize going from one meeting to another. To address your question, Representative, we do not license clinicians. That is, I believe, all through the Department of Public Health. But we do still complete the eligibility process for individuals that are looking to receive autism supports and services through the Department of Social Services. So DDS does complete the eligibility review and approval process and work closely with DSS if and when that determination is made. So I appreciate, Mike, I think it was your suggestion to include DDS in those conversations. I appreciate that. We have a very knowledgeable eligibility unit that's led by Dr. Kathleen Murphy. We can include her in those discussions as she is much more familiar with the specific sort of requirements and documentation that's needed for that process.
So I think as Lynn and Ann talk, right, I think it's really important to include DDS or whomever you feel, Krista, should be at the table. And then you also want to make sure that you have DSS in there, which I would go to Amy for it to either be herself or whoever she believes should be the person from DSS, because we want to make sure at the end of the day we don't leave out an agency where we're going to run into a roadblock because we didn't realize. And I think that's what's great about this council, is that we have almost all of the human services, if not all of them, on this council. So thank you for raising that, Lynn. And I think this is going to be something that could be achievable. Now, it's not going to be short term. I just want people to understand anytime we amend licenses or expand them or anything like that, it really is more cumbersome than it probably has to be. But having said that, I still think it's a goal that this council should move forward. Jim?
Well, I think, there's a lot of administrative issues absolutely with this question, but I don't think you can move forward without the involvement of, the clinicians of psychiatry, of developmental pediatricians, of psychologists, of social workers, of others, because it's not an easy diagnosis to make. And you can't just sort of say, okay, we're going to let these people make that diagnosis. We're going to include our people who can make that diagnosis by adding others from a different kind of type of training. The problem is that there just aren't that many people who have the training. I think, Dr. Schlegel would probably agree with me. I'd like to hear from her on that. But you can't just, we had great difficulty with the ADOS, where the people who do the ADOS is the sort of the gold standard test. And they said, okay, these, more and more people can give it. And then parents and people were just getting more and more confused because they were getting different, unhelpful diagnoses, or they were just getting a label and nothing else. It just created more problems. So this process that you're talking about, I just think you really want to include, leadership from state psychiatry, state psychology, state developmental pediatrician, social work, behaviorists, all these people, because that's really, they're the ones who are going to say, here's the most effective, efficient way to get this diagnosis.
So Jim, I couldn't agree more with you. And just so people understand what the process would be, right, is that when we were talking about Lynn and Ann getting together and now including the other agencies, right, they would talk about whom they believe that this evaluation could be extended to, right? Then a bill would have to be, because you're changing state statute, a bill would have to be introduced in the Public Health Committee, right? And from there would be a public hearing, and then other providers would have the opportunity to weigh in why they believe that they should be qualified to be included in this group. So you're absolutely right, but nothing is done behind closed doors, right? There's
but I guess what I'm saying, Kathy, is that bringing in the right people at the beginning is going to give you a better bill for hearing than by sort of throwing something up against the wall and then having groups come in and say, hey, this is right, this is wrong. That's all. I just think you want to hear from the people who really understand the diagnostic process.
I agree with you there, but it's a little bit more complicated than that is all I'm saying to you. So that's why I'm saying there's a process in place. And I think it's a really good process, right? Because everybody is going to come out of the woodwork and feel that they're qualified to do this work. And I've seen that time and time again. And then what happens is groups are pitted against each other, which is not what you want to do. So that's why I'm saying to you, there is a process in place. And I think it's a good process. But your point is well taken, and I agree with you there. Lynn, Ricky?
Yeah, so just to clarify, so the psych tech role, which has been approved, it's already part of a license, it was already agreed upon in licensure, and there is a structure for them to work within. So I'm happy to pull that, I can't recite it to you now, but that, there is a structure, they work under a licensed clinician who has the expertise in the area, and they're really a psychometrician. So they are doing the testing and then working with the licensed clinician who has the expertise to provide diagnoses. So I'll do a little bit of, of a framework for folks and put it together and, maybe get it out to, start with Ann, and then we can carry the discussion further and see if it's something that is of interest. So it's not reinventing a process. The process does exist currently under the current structure and has for a couple of years.
Thank you, Lynn, for that clarification. Sure. I think it's a great way to start. Sarah, followed by Gemma.
I just wanted to add on to what Jim had said in terms of really the rate limiting factor for diagnosis and accessing services that we're describing is really the administration of tools, and that you're talking about the psychometricians, right? We have the acceptable tools are, the ADOS and the CARs, which are, both ones that we can administer, but they are time consuming and require specialists who can administer them, and and somebody who can make that diagnosis based on them. So that I will agree is an enormous problem with the limited number of people who can do that. And I mean, there's a reason it's a limited number of people, because they have to be trained and they have to be able to interpret them properly. And, I understand that. Just to give you a little bit of the scope, there are 706 active developmental behavioral pediatricians in the United States, and probably maybe 10 in Connecticut. So we're really talking about so few of us in DBP. And then we add, the psychologist. That's why I asked that question of you, Jen, because, it really is a rate limiting factor, which I appreciate and understand why, but this is what we keep running into, and why our wait lists are so high. And, we're really struggling to get these kids processed and through, but it's a real challenge. I understand the other pendulum, the reason it became like this, because, historically anybody could just say, oh, yep, this kid has autism, and we were overwhelming the system in that way too. So I don't have the solution yet. I wish I, had a great, brilliant idea to solve this problem, but I recognize this is a big challenge, just the lack of supply, of diagnosticians and service providers for the subsequent treatments. This is a big limiting factor. Thank you.
Yeah, Sarah, I couldn't agree more with you. Gemma, followed by Julie.
I'm as a parent of a child with autism, I never really understood my scenario when I was getting my son diagnosed at 4. At age 4, we went to a neuropsych. I paid out of pocket for it because I was on my, commercial benefits through my employer. And she diagnosed him with autism. We didn't go in there looking for that, but that's my son's story. When he got to school, they didn't have to diagnose him. They did intellectual delay up until age 6, but they did not accept the neuropsych's diagnosis. They had to re-administer the ADOS for him to get services in school. And so my question is, and maybe we don't have an answer today, and I don't know if Brian's still on the line, but why are we not leveraging the school psychologists or those providers that are diagnosing kids in school for at least age 6-year-olds? And again, maybe my situation was different, but I had to get a medical diagnosis and then a diagnosis through the school. And that just seemed totally redundant. And that's just been, that was whatever, 8 years ago, but that was my story. And I don't know if we're missing an opportunity or if that was just unique to me for whatever reason. It just seemed like he got the ADOS twice.
So we have 2 people here with a little bit of expertise, or a lot of expertise. We have Brian from SDE, if he's, comfortable commenting, but we also have Carrie, who is on the Board of Ed for Berlin, who might want to add to, from the school board's point of view, their thoughts. So I'll turn it over to Brian first, from SDE.
Thank you. Thank you for those comments, Jimna. Yeah, I mean, this area causes quite a bit of confusion, and the differentiation is in schools through the special education process. They're determining educational disability category with the impact on education. It does not require a formal diagnosis for a student to be eligible for special education under the primary disability category of autism outside of the schools. However, in your case, it sounds like there was some repetitive evaluations that were done. In the ideal circumstance, the schools would review and consider any outside evals and incorporate that within their comprehensive evaluation for initial eligibility. So going into a PPT meeting, as you said, like you weren't looking necessarily for a diagnosis specific to autism. When a school planning and placement team does an initial evaluation, they're required to do a comprehensive evaluation, which means that they're considering all of those 13 federal disability categories and working through as a team to be able to determine if the student one has. And then even if a student has autism, that doesn't necessarily mean that they require specialized instruction. So then there's that second tier of now does the student require specialized instruction as a result of their disability? So I think there's work that needs to be done for informing both parents and, planning and placement teams to continue to support them as they're making those determinations. The other thing that sprung up in my mind when you were speaking to, and we were having this discussion, is to take a look at our autism guidelines. There have been individuals that have said our autism guidelines, should be and need to be updated. We have a guideline review process that we have sort of a regular cycle of updates and review on, but we've received some feedback, some from parent advocates, others from school districts on the need to revisit the worksheet that's utilized to determine or to assist teams in making those determinations at the school level.
Interesting.
And-
Okay.
And I'd like to turn it over to Carrie, just because Carrie, being on the Board of Ed for Berlin, could also bring a different perspective. And Brian, I'm sure that you have worked with Carrie, through the years. But this is a great opportunity if you are looking at reworking that sheet for the autism community, to have Carrie give a second set of eyes, because she brings such a unique perspective as a parent, as an educator, right, at Southern, and then, oh, by the way, on the Board of Ed. So she gets to put all those buckets together, which might be helpful to SDE. And sorry, Carrie, if I volunteered you for something, but I know you're always willing to help. So I'll turn it over to you.
Thank you, Kathy. And I am very invested in obviously doing whatever I can to support this community. So yeah, and I think Jimna's point is a really point is a really good one, and one that has kind of long been and continues to be one that's in the forefront of a lot of parents or family members' minds. So, as Brian said, one thing that I trained school psychology graduate students for a number of years prior to occupying the role that I currently do here at the university. And so school psychologists also struggle with, well, we're not really diagnosing kids. And in fact, you're not diagnosing kids within schools, right? So to Brian's point, it really is determining whether kids meet the criteria for an educational eligibility for special education services, right? Under whatever the established criteria for the various 13 disability categories. So it's eligibility versus diagnosis. And as Brian said, that's a really hard thing for, I think, any of us to grapple with and understand. Well, if you have a diagnosis, why do you not automatically qualify for services? Or if you qualify for services, why do you not have a diagnosis, right? And those are really, it is puzzling as to why those things don't often sort of dovetail seamlessly, but they don't. And that's because our systems don't necessarily always kind of jive and work well together, and for lots of other reasons, I'm sure. At any rate, I think that, it's a really fair point, and one that, Jimna, I will say that you are not alone. I can say with a great degree of confidence, you already know that. But as parents, it can be incredibly frustrating, especially when the messaging that is out there is, you need a diagnosis for your child as early as possible, because early intervention is is what's going to yield the best outcomes for your kid. And yet, how do we get there? Like the process, whether it's in through the diagnostic pipeline or through the educational pipeline takes time. And it makes us all, I think, feel very anxious and worried that we're not acting fast enough. But we've already highlighted in the course of this meeting today all of the challenges to not just getting our folks to a diagnostician, but also to working through the systems and that exist as they exist, to leveraging those services. But yeah, there are a lot of challenges to that. Kathy, I think as a Board of Ed member, more so it's about educating from where I sit on the Board of Ed, it's about educating our Board of Ed members about what are these challenges as they exist, so that they are more informed. Because I think even, those of us who occupy this space are confused by the twists and turns of the paths that we take here. So the more we can do that, and the more kind of connection and kind of bi-directional communication that we can establish between the State Department of Education, the boards of education, outside clinicians, and school teams, and so on and so forth, the better off we'll all be.
I totally agree with you there, Carrie. It's the smooth transition that we're all looking for. Gemma, before I give it to you, just so everyone knows, Brian just had to transition from his whatever device he was using to his phone. So that's why you're not seeing his face. So if you see a number come up, an 860 number, that's going to be Brian. So I just want everybody to be aware. Gemma, did you have another a question or a comment?
Thanks, Kathy. No, both Brian and Carrie, your oh, I'm getting feedback.
That's okay. It was just Brian's. Yeah, I think he's all set now.
And Carrie and both of you really explained it to me, because that was always kind of sitting for 8 years in the back of my mind, why it went down that way for me. But hearing this conversation, back to, the number of diagnosticians available in the state, that was just a puzzling piece to me. And why do we have this untapped resources in the school systems? And it sounds like we did it for obvious reasons that I'm just learning or just understanding. So I super appreciate just that breakdown. And I know we took up a lot of time, but I'm just trying to think of ways that we could find more people that could make these diagnoses more quickly. And yeah, age 6 isn't, early, right? Certainly not early enough, but that's the age that my son finally had the autism diagnosis on his IEP. So that's why I was just thinking kind of off the cuff here. But thank you, Kathy, and thank you, Brian and Carrie. I appreciate your explanation, and we'll keep
Carrie.
Yeah, no, absolutely. And I think that's what, this council should continue to do. Just one more thing that I forgot to say was that to Jim's earlier point, just to kind of extend something that Jim said earlier, even school psychologists, clinical psychologists, et cetera, not everyone, and I'm making it sort of a very broad statement, just because you have a certain credential doesn't mean that you are skilled and trained in this diagnosis. And so what I would say is that and this is just my personal opinion, I think that there are a great number of folks who have the potential to be trained in this, in diagnosing autism. However, I don't think it's a matter of saying this category of professionals is qualified. It's about looking at the training that individuals have received that would make them so qualified. So we certainly can't say that all psychologists are equipped to make this diagnosis. There are lots of psychologists who work with, populations that are very good at what they do, but are not necessarily equipped to conduct an evaluation that would result in this diagnosis. So.
Thank you. And Kathy, I think that just reminds me to go back to your point earlier, like what can we do as a body, as a state to enhance or incentivize potential workforce people, that are, can become or maybe best suited to eventually be able to administer these tests properly. If they're right, if the training is just an additional, I don't know, I'm totally minimizing the training, but if they're at the cusp, and if, as Carrie said, if they're, they could be, then maybe that's something that we need to look at, incentivizing them to take that extra step. I don't know how we do that, but I know Kathy, you had made that suggestion earlier at the opening of the meeting.
Yeah, no, and Gemma, I think it's great that you raised that from a parent's point of view, because I want this council to also remember you're on YouTube right now, right? This is being streamed live. So you have families out there that are sitting there listening to this conversation, and it's really helpful for them, right? Because sometimes as a parent, you feel alone in this journey, right? And this council, this council has, in my opinion, has a responsibility to make sure that they understand their audience and that these conversations continue, right? Because even though everyone that's on this council, is involved with the autism community, right? You also have to remember that our part of our role is to educate the public and to help families that are out there that are struggling. So Gemma, these questions are really, really helpful. And Carrie, as always, your information is helpful, and we're so personally thankful that we have the agencies on here too that can tell us from their point of view what needs to be done. And also, I keep telling you guys, agendas for legislation to be changed starts in this group, right? That's why we're all here. So no, thank you for that. Julie?
Yeah, I was just going to add to what Jim and Sarah and Carrie and others have said about sort of the challenge of the training component, right? Because it's not just a matter of training providers on measures, right? We have the ADAS, we have the CARS, but those measures rely on sort of the clinician already having expertise in autism, right? They are measures where you're coding observations about the child, and you can't code it correctly if you don't have sort of the context of what autism is. And so just as an example, at Yale, we train trainees on the ADAS. We bring in trainees who've already been through like a 5-year PhD program where they have specialized in autism. And then we spend another year like really getting them up to speed on the ADAS. So, and I think we have a high standard of what we're looking for because we train them to a level of like research reliability, which isn't necessary for everybody. But we are talking about, the clinicians coming out of our program have 6 years of doing nothing but autism and learning the ADAS. So it is a very high level that we're talking about. And so trying to figure out how to sort of balance that with also the needs of just getting more clinicians out there who can do this work, I think is a challenge and hard to sort of figure out how to solve that problem.
Agree, Julie. Thank you. Jim, you had your hand up originally. I don't know if it came down by mistake and you have a question or a comment, or if you want me to move on to the next person.
No, I think it was covered by others. Thanks, Kathy.
Okay, thank you. Doriana?
I was just going to say that I think that this has been a great discussion because it is so confusing for parents, especially starting out, when they're given a medical diagnosis or one from the school system and then finding out for all things. So, and again, it seems like it's very expensive for parents. It delays really truly getting help. And it is extremely confusing when you enter into this new world that you never thought you'd be in. And it would be nice to make things a little simpler and easier and be able to get help quicker.
Agreed. Any other questions or comments?
I have one.
Go ahead,
sorry.
Yana. No, go ahead,
No.
honey.
So from a self-advocate's point of view, I was diagnosed, and this was back in the old days when dinosaurs roamed the earth. I was diagnosed at 12, but we knew that I had more than ADHD. That was my original diagnosis, but my psychiatrist said there's got to be more than ADHD, and he recognized that it's more than ADHD and it's not oppositional defiant. And he was the first one to make the diagnosis, but I was very lucky. And this was when I was 12. I was very lucky. I went to a clinical day school for kids with special needs, and I had the therapist that had more specialized, and they were able to help. but it made a big difference when we got the diagnosis and when my mom got the Asperger's syndrome book by Tony Atwood, and she started reading it, and she read it with me. She was very open, but she said, "This is you." It was very open. It opened new doors.
Thank you,
But it's
Jana.
sad. It's sad that it's still taking so long, and there's still so many adults that I know that are self-diagnosed. They didn't get their diagnosis until they were adults with kids of their own who got their diagnosis. But it's sad that kids today still it takes so long. It shouldn't take that long, because when diagnosis happens, it's an eye opener. It's life changing.
Thank you, Jana. You're 100% correct, and we're so lucky to have you as a co-chair and also on this council. So thank you for that. We appreciate it. Any other questions or comments about this item? Anne?
I just want to have it come full circle. I would always, and I'm sure Lynn and I, after our initial discussion, will always invite in the experts that are in this room. There would be the need for the guidance, and there would be the inviting of the guidance. And this is a very complex situation for families. Having experienced it personally, having a child that sits kind of in the middle of two Venn diagrams between medical and educational and what that means. And families can't have to wait until there's it has to be an easier way to do it. It can't be this individual journey. And Jana just spoke about her journey and how her mom really helped her and guide her through that. It's very hard to do this one at a time. And I know we have the right team of people here to do it. I really do. I feel like we need everyone to come together to address this, and that we would move forward with the guidance of people on this group. It's just very, very necessary. So we appreciate everybody's help on this.
Great.
Thank you, Anne, and I agree with you. I think that this team that we have here can really come together and make some, decisions that'll help our families. That's the bottom line. So thank you to everybody for your comments. So appreciate it. Moving on to the next item, the autism waiver update. Amy, do you have any update on that? And then can you also, under this category, can you also talk about if you've hired any of the caseworkers for the new amount of kids that are coming off the wait list?
Sure. Yes. Good morning, everybody. I'll give you an update on the waiver and the waiting list. And so as of today on our waiting list, we have 2,039 folks that are on the waiting list. Currently, speaking about the waiver, we have 203 cases that are assigned to case managers, and we have 168 actually active on the waiver. We have 35 individuals who are in process of coming on the waiver, and what that means is either they're waiting for financial eligibility or they're waiting for the case manager to get out to do the assessment. So we have taken 68 people off the waiting list. That was the 50 in the prior legislative year, and currently 18 of that 150 that was allotted for 2022. We have 11 people that were on the waiting list that we discovered had either moved or had declined services. So then we just are jumping to the next ones on the waiting list. So with that being said, we have completed our interviews for the case management positions in order to move forward, because the goal is that by June of 2023, we're at 344 individuals on the waiver. We have picked 2 individuals for the positions, and that is now in the hands of our human resources and our affirmative action department to move that forward. So I'm hoping that we can make offers soon and at least have them in those positions by December. That would be my hope. And a couple other things. So just to circle back to what Jen Cram and some others have talked about earlier about providers, we continue to have that struggle as well. A lot of the issues we're having is in Eastern Connecticut and Southwest still. But I will tell you, we've had some of the waiver staff, particularly Michael, Lisa, and Nate, do some outreach to the providers that provided just state plan services, and to give them some more education on the waiver, and what we offer and how to enroll. So we've had some positive response. So I'm hoping that going forward that they will choose to enroll as a waiver provider. So we just have to continue to make those calls and advocate that they move forward with those applications. And those also take some time too, unfortunately. And then, the last thing I wanted to say was I have the potential of getting an intern, an MSW intern from UConn. I have a meeting with her this Friday, so I'm hoping that she'll be able to join our team and be an extra resource for us. Not sure exactly what we'll have her do. I think it might be something in the housing arena. So I'll have her for the whole year, which will be great. So I'll have more of an update on her the next time we meet. And by the next time we meet, I'll also be able to put forth the name of the 2 new case managers that were hired. So that's where I'm at today. I'd be happy to answer any questions.
Thank you, Amy. Have we heard from CMS yet if the waiver, the amended waiver has been approved?
It has not yet. They did come back with us with a few questions. We responded last week. They had a couple more questions. We responded again, and that response is actually due today. So hopefully we should be all set after that for a 1/1/2023 start. That happens often where CMS will come back and they have questions. A lot of the questions that they had surrounded virtual visits and telehealth. Which I understand, they want to understand our process and accountability for those services, and how we're going to monitor them. So I understand that, and hopefully once that response goes back to our state contact today, we'll be good.
Thank you. And just so everyone understands, it's not uncommon for CMS to come back to DSS with questions about any amended waivers, or even when you're applying for a state plan amendment or a first time waiver. So this is very common. And I always like people to understand it's not for the lack of work on DSS's part. They submit it, and then CMS, they can come back 10 times if they want with questions. So thank you for that update, Amy. Jim?
Thank you, Kathy. Last meeting, we talked about the training needs of life skills coaches and who was going to pay for that. And I wasn't sure we reached sort of full a conclusion on that. But I think there was, in other words, they clearly need the training, but the agencies were saying they couldn't afford to pay for that time. And there was some question as to whether the Medicaid waiver would pay for that time. Was there any resolution of that?
I'm going to turn it over to Amy.
Yeah, I don't believe, Jim, that we resolved that yet. We're still talking about that and ways that we could manage that and cover that. I understand it's an expense. However, it is a necessary service. But I will be able to report back out probably the next time we meet with more confidence than I can today.
Is that a DSS issue or a CMS issue, or you know what I mean?
That will be a DSS issue ultimately.
Okay, thanks.
Yeah.
Jim, and I want you to know that when we had the hearing, so the Appropriations and Human Services have to approve all waiver amendments. And we raised that issue with DSS at the time, and we believed that DSS should find some funding within their budget to be able to help these agencies with that training, because we all agree that it's a necessity for them to have this training, but at the same time, you don't want to lose people because of the fact that these agencies just don't have the resources. So I know Amy took that back to DSS, and I know I can speak for her that they are trying to figure this out and how do they pay for that training. So
yeah, we do have a few ideas circling around right now, so just trying to really pin that down. So thank you.
Yeah, and we can keep that as an agenda item going forward, so that we can keep updated on that. So thank you, Amy. Any other questions or comments? Seeing none, I just always want to make sure I don't miss anybody. We will move on to the next item, which is the Center of Excellence update. And I think this is you again, Amy, or is this someone else from DSS?
Jennifer's going to speak about that today. Thank you.
Great, thank you.
Thank you. Thank you, Representative Abercrombie and the council. So I know certainly this has been a long process, a long, lengthy process. As everybody knows, I'm newest to the team, but have been working on this and read the feasibility study that was obviously, done in 2013, I believe. So just looking at some of those issues. So we've redefined, looked at some of the definitions in the request for qualifications and request for proposal that will be going out. We've put together our schedule and timeline. So hoping that this will be able to be released in the next several weeks so that we can begin to get some qualified, get some procurement and get some individuals interested in partnering with us on this and taking into consideration some of the changes that have happened over the last 9 years from when the feasibility study was originally done and making sure that that's incorporated into the Autism Center for Excellence.
Okay, just.
Questions?
If I may add just one additional comment also, I did want to share that I think hopefully will be of interest to the council. As one piece was Amy mentioned, certainly getting an intern, but we also have engaged with CMS. They offer technical assistance for home and community-based services. So we've engaged with them in a year-long process for the autism waiver to specifically look at how other states have been innovative in serving, number one, as many individuals as possible off a waiver. So looking at different authorities that we may have, also ways that they've been able to incorporate supportive housing models, transitional services, which we've identified as looking at the number of people that are on our waiting list, where that group falls in terms of their age group and their needs. So I think that that will also be, very useful in leading our work going forward.
Thank you, Jen. Questions? Doriano, followed by James.
Jennifer, does that mean they're possibly in this year-long technical support? Are they looking at possibly the states that have gone to an optional waiver that caps out the money to say $10,000 annually or $15,000? They looking into that?
They are right. What they're looking at really is across the nation, how have different states served the needs of those with autism in a variety of ways, and whether that's a 1915C waiver, which is what the autism waiver is, or is there a different waiver authority that we may be able to use to serve a different set of individuals? Can we, carve something out? Can we prioritize? We've talked about individuals who, may be in a crisis situation because they may be, have a parent that they're residing with who's hospitalized. So being able to perhaps, to hopefully maybe make some changes, to the waiver that, one, help us serve more individuals. We certainly know there is a $50,000 cost cap, but when we look at the amount and percentage of services that are being used, it is less than 50,000. So how can we put that, to best use, serve as many people as we need, while also recognizing that this is a lifespan waiver. And so the needs of somebody, perhaps at, age 18, may be very different than somebody who's age 52. And how do we, plan for that going forward?
Thank you. Doriana, you all set? Yes, okay. Jim?
Thanks, Kathy. Thank you, Jennifer, for reporting out on that. That's very hopeful news. So in the next couple of weeks, RFPs will go out to agencies?
It will be posted. The next step would be once everything is approved, then it gets released. Then they have an opportunity to ask questions, the whole sort of process. But we've put together a procurement schedule so that we can keep things on target.
Oh, excellent. But it's that close to really taking the next step.
Yes.
Okay. And does it look any different than in Hollywood? The script always looks very different at the end than when the writer first writes it. Does the proposal look different than where we started? Or I mean, what do you anticipate that we would be asking for with this?
Still asking for, two of the items that were included in the request were really developing, a comprehensive website that's consistently updated with resources. That was one piece. And then the other piece was the Autism Center for Excellence. That was to collaborate and provide collaboration really in partnership, with the autism waiver team and help, really in identifying, gaps and additional resources. So I don't think it's changed the language per se. We've just added some definitions, and I think the work will really be when obviously this is implemented, what that looks like based upon the feasibility study in 2013 and, where we are in 2022. Though, just in listening to today's conversation, some of those themes are still there. We're having, in reading the feasibility study, tremendous, issues, right, with access and with providers and provider training and education for families, and really looking at, as, those impacted by autism as, they're aging and their parents are aging and what, that looked like 9 years ago and what it looks like now. So making sure that we incorporate those things.
Great. And there, thank you very much. That's great news.
You're most welcome. Thank you.
Thank you, Jim. Thank you, Jen. That was really helpful. Any other questions or comments? Well, it looks like we're moving that forward, which is great news. I know everybody is very appreciative of all your work on this, Jen, and they look forward to the posting of it. So thank you very much.
Thank you.
Moving on to the next item, which is our housing subcommittee discussion. So this is going to be a two-piece. So first, I want to take the opportunity to thank everybody that offered to be on this working group. This working group has not met yet because of the fact that I thought it was important for whomever is going to be the new co-chair of this council to be involved. And because this will be my last meeting, I thought that we should wait until after that to have the group meet. So thank you to all of you that have volunteered to wanting to be part of that working group, and next steps will be coming forward for that. DSS, Amy, keep in mind that might be a good opportunity for your intern if they're going to be doing the housing to be the connection for you guys. And these interns, I have to tell you, we have a great intern program at the legislature, and I always take an intern, and they are amazing, these young people. So you're really lucky, especially to be getting somebody from UConn who's willing to do the hard work. So
yeah, I'm excited. We've never had one before, so it's great. Yeah,
it should be. They are amazing, these young people. So that'll be great if perhaps that person, if you decide that housing is going to be their initiative, for them to be on this this working group. Next, I'd like to turn it over to Krista Ochashevsky to just give some comments about, and I don't see her. Oh, there she is. Sorry, Krista, sorry. On the Zoom, sometimes you lose somebody and I'm like, oh, did I lose her? Just to talk about some of the things over at DDS.
Yeah, absolutely. So thank you to the council. I was asked to provide a quick update around some housing initiatives, specifically IDASH. And then I'm also happy to talk about additional residential settings that the group may be interested in learning more about. So I think, we've had some discussions here about IDASH prior. So this is going to be more of like an update on how things are going. For those that may not be completely familiar, IDASH has been an ongoing partnership between DDS, DSS, and the Department of Housing to really work on some supportive housing initiatives throughout the state that assist individuals with intellectual disability, individuals on the autism spectrum, to provide a supportive housing structure that also includes the participation of a provider to provide additional wraparound supports. So there are 3 housing complexes that are up and running through this partnership. The first one was Bear Woods, which is in Avon. That was the first complex that provided support through the IDASH partnership. There are 10 units that were set aside for individuals with intellectual disability or autism spectrum. I was not directly involved in the process, but my understanding is that applications were submitted by individuals interested in living in this complex, and then there was a selection process that was made. The provider that oversees that partnership is FAVAR. I actually had the pleasure of being able to visit the complex when it was in the midst of construction. It was absolutely beautiful, and it was really amazing to see all the creative and really progressive options and opportunities that FAVAR had integrated into the complex. I have not been able to get there after it's been opened, but DDS did do a specific housing forum in which we were able to do a live stream of a couple that lives at Bear Woods, and they showed their apartment at Bear Woods. And
I think I know who you're talking about, Krista.
Oh, what was that? I'm sorry, Anna.
I said, I think I know the couple. And
yes, it was fantastic. I think we have a link of that live stream on our website. I'd be happy to send it to the council afterwards, but it was just a really great opportunity for people to see the complex and see all of the different amazing sort of opportunities that the couple was provided as part of this partnership. So I'm happy to share that link afterwards. The second complex that was created through the IDASH partnership was Cottage Gardens in Hartford. There were 8 units set aside in that location. The provider that's partnering there is HARC, and I believe that complex opened up last December. Most recently, the third complex that opened up was Lavender Fields in Bloomfield, and that's a very recent complex unveiling, essentially. They are the provider partner in that location is also FAVAR. So FAVAR has 2 complexes that they're providing supports and services through, and there's 9 units that are set aside in that location. My understanding is that the IDASH partnership process has ended, but there are numerous different ongoing discussions that are happening about different supportive housing options that can be available. And I think IDASH really opened the door for that ongoing discussion and partnership that includes Department of Housing. Department of Housing has been an absolutely amazing partner and has brought a lot of resources specifically on the federal level to those discussions around supportive housing. So that is my very brief update, but I'm happy to provide additional details and provide resources that the council may be interested in learning more about.
Thank you, Krista. Thank you very much. Marcia?
Yes, I'd appreciate it if you could give some indications of criteria for someone qualifying for the housing and what kind of waiting lists there are, what kind of population is there. Is it, single, would a single male adult be appropriate as opposed to couples or, kind of the ages of people who are there, things very pragmatic, because I do have some patients who would be probably interested in something like this.
Yeah, absolutely. So my understanding is the 3 complexes that are open, I believe all of the units that were set aside for individuals on autism, on the autism spectrum, or receiving DDS supports and services have since been filled. I'm not sure if there is a waiting list that is captured, but I'm happy to go back to our housing contacts at DDS and those that participate in the IDASH partnership just to get a little bit more information and provide that that back to the council. It is really a wonderful opportunity. What I can also do is see if I can gather some additional information about other complexes that are in the works, although they're not being done through the IDASH partnership. It's a very similar collaboration in that it's a supportive housing collaboration with a provider that's participating to provide wraparound services. So I'm happy to provide that information about the IDASH complexes and then also provide some additional information about ongoing collaborations that are up and coming in the near future.
So Krista, if you could send perhaps the link from the interviews with the 2 individuals that are in the housing right now. And if you could also maybe send a 1-pager on the criteria and some of the providers that are out there that are doing this good work, if you would send that to Lisa, our administrator, so that she could send it out so that everybody has that, that would be really helpful. So thank you for that. Jim?
Absolutely.
Yeah, with that kind of success, Krista, I'm just wondering, is there, an I-2.0 planned? I mean, it just seems like 3 projects like that. I mean, that's really great collaboration. I mean, and then the other sticking point though is that, I think our experience has been that this model, while wonderful for the people it serves, does not fit the people with most people with autism, that they need. They need services, but a lower level of services, and so they can get by with a different kind of a funding structure. But what are people talking about for the future?
So that a great question, Dr. Loomis. I'm not aware of an I-2.0. That doesn't mean that there may not be one in discussion, but I am aware of additional collaborations that are occurring separate from the I-DASH partnership, but very similar in that it has DDS involvement, DSS involvement, and Department of Housing involvement, and they're being created under sort of a supportive housing definition. So there's specifically a complex that's under construction currently in West Hartford. I believe it's called the New Park Complex. That is getting close to opening. I believe it's in the process of accepting applications. I do not remember off the top of my head that the provider that's partnering in that, but I'm happy to provide that information after this meeting. So I believe that I-DASH essentially sort of opened the door for that partnership. There was some funding set aside for the partnership specifically, but that doesn't necessarily mean that there can't be additional discussions between sister agencies to look at that collaboration moving forward. Again, I'm not familiar with an I-2.0, but I do think there's ongoing conversations very similar to that partnership that continue to occur.
Thank you.
Mm-hmm.
Thank you, Jim. Any further questions or comments?
Oh, I have a comment. So my concern is that our individuals are kind of being overlooked again, and I'm hearing from a lot of parents on social media that they're very frustrated that their individuals are being overlooked. They think that no one cares, that I think they've been forgotten. And with this I-DASH, I don't know no one of my friends that are on the waiver are in housing on the I-DASH, and I think that we need to kind of look at this again and maybe customize it for our population. That we don't need 24/7 supports, but we might need more social supports, more social, emotional, and more supports, some support during the day. And what I've been advocating is for this to have us support one another, to have maybe a few individuals in one apartment building. We could support one another. Somebody who drives can help with driving. Somebody who can cook can help with cooking. Instead of a model like for the ID community, we could kind of support ourselves. But it seems like because of Medicare, no, I think it's the Medicaid stipulations, we can't do that because they said too many people with a disability in one complex, that it could put our benefits at jeopardy. I don't think that's really fair.
And Yana, you're absolutely right. And that's why we have the working group that's going to be meeting to kind of meet with housing and DDS to kind of figure out where, you know, I'm going to use your words, your population fits in the whole housing conversation. And yes, you're right. It's very complicated, but at the same time, it's very needed at this point. So you're absolutely right. And I'm sure that the working group is going to dig into that and see what are the obstacles and also what are the opportunities that we as a state can take advantage of, which we currently aren't. So thank you for that, Yana. We really do
that
appreciate
Medicaid
it.
thing. Because there's so many good, I've been doing so much research. There's so many good models out there in the Nordic countries with co-housing. I think that would be perfect for our population that doesn't need 24/7 support, that needs more support along the social side, to have maybe a complex where individuals are assigned to another family in their building and they support one another. Suppose your family was in a building and there was an individual on the spectrum in that building, you could be assigned. You could check in on them. They could have dinner with your family once a week. And
yep, you're right, Yana. And I think
take them shopping when you go shopping or when you're going out in the community. Include them. Kind of like that, supporting one another instead of a paid support, natural support.
You're absolutely right. And I think those are going to be all of the good questions that will be asked through the working group. So you might want to make sure that you're part of that working group. And as a co-chair, you know that you're automatically on it. So we're going to be sending out some information about that and some dates and times in the agenda going forward. So thank you for that, Yana.
I think we have a lot of opportunity in West Hartford. And I'm going to reach out to my state rep, Representative Gilchrist, about this, let her know that they're putting up all that new housing in West Hartford Center on Troutbrook. I think that would be a perfect place for housing for individuals with disabilities, especially our population, a lot of whom don't drive, because it would maximize independence. I think that's another thing. It has to be transit oriented. Because Favar is beautiful. Yeah, Favar is a great, their housing complex is great, but it's out of the way. They provide transportation for their individuals. Our guys can be very independent, but it has to be transit oriented.
Absolutely. Yep. And reach out to Jillian. She's a great state rep. So I think that's a great idea. So thank you for that, Yana. We only have a couple of minutes left and we have two big items left to talk about. So I really would like to kind of move this along. First up is the 2023 meeting dates. Lisa, can you walk us through that?
Yeah, so I guess usually what we do is we go through and we choose the dates, and then what I will do is I will send out a meeting dates list.
So why don't we do this? Why don't you kind of mirror the dates from last year and send that out to everyone and see if those are acceptable? It might be easier than us sitting here now and going through the calendar. Is that okay with everyone on the group?
Okay.
Thank you. I think that'll be a great way to handle it. Now we're going to, if there isn't any other discussion under old business, seeing no one raising their hands, we're going to go on to new business. So as I talked about at the last meeting, this will be my last meeting. Being that I am retiring, I didn't run for re-election. Gemma and I have been meeting with some individuals to try and figure out who would be interested in becoming the new co-chair. So what I would like to do is open this up to nominations so that we can get that person on board so that we can have a meeting after this meeting with the new co-chairs. And then also 3 of my colleagues are interested in being on this board to take my place as the legislative person. So I would like to, talk to them about that and then see, who has the ability to contribute the time that's needed to this council. So with that, I would like to open it up to nominations. And I see Lynn Rickey has her hand up.
Thank you, Kathy. I would actually like to nominate Doriana Baistamini as the new co-chair, taking your place, Kathy, or trying to step into your shoes like any of us would. So, Doriana.
Do I hear a second?
I'll second.
So we have 2 seconds. We have Carrie and we have Yana. Thank you both. Any discussion at this point or any questions for Doriana? Seeing none. Doriana, do you accept the nomination?
I do.
Okay. Before we go on to a vote, we want to be fair. Are there any other nominations that anybody would like to put forward to be the co-chair of this Autism Advisory Council? Any other nominations? Any other nominations? Seeing none, we will close the nominations and we will put forward Doriana as the new co-chair of the Autism Advisory Council. We've had a motion and a second, and now we will take it to a vote. All those in favor, and please unmute yourselves. All those in favor of Doriana being the new co-chair of the Autism Advisory Council, please signify by saying yes.
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 Any nays? Seeing none. Doriana, congratulations. You are now the new co-chair of the Autism Advisory Council.
Thank you.
Thank you so much for
Thanks, Doriana.
volunteering to do this. Before we get ready to adjourn, I just want to really take this opportunity to say thank you to all of you. It's been my honor to be part of this group for 16 years. And you guys know you have my heart. You always have. The autism community has been really special to me. It's been my life work, which I'm proud of. And I know I'm leaving you guys in great hands. I told everybody I'm not changing my cell number. So if I can ever be any help in the future, I will still be around. I'm in a good place with retiring, but as all of you know that put your heart into the work that you do, it's not easy to let go of something you love. And this council has always been really near and dear to my heart through the years. So I really just want to thank all of you for your hard work, because we do this as a team. We don't do this as individuals. And this council has always had the best of the best when it comes to the experts that are out there. And you're going to continue the good work. So I just really want to say thank you for 16 great years of being with you guys. And I will always be here to support you in the future. So with that, oh, you're welcome. It's
Thank
been
you,
my
Kathy,
honor.
for all you've done. We're so grateful, and we hope that at some point we see you again soon.
So just before we adjourn too, so I don't know what the future is going to look like as far as the legislature being in person with all of the meetings, or if they're going to be doing a hybrid. They did have a caucus last week, and it's still being negotiated between the House and the Senate, and the Democrats and the Republicans. So the one thing, and I'll help navigate this for you guys. Normally, I was the one that was able to set up the rooms to have the in-person meetings. To get the rooms in the LOB, it has to be done by a legislator. So whomever becomes your next liaison, that person will be able to set up the rooms. But as soon as we know how the speaker is going to decide the future of meetings, I will let you guys know so that the chairs can send out a notice to everybody saying, hey, we're going to continue on Zoom, or hey, we have the ability to be in person. I think you also should consider that you could still, even if the legislature, the LOB is open for you to have meetings in person, I think that you still have the opportunity to do these as a Zoom. So I think that the leadership, you guys should really kind of think about that. and decide from there, you know, what's the best way. I think the one thing about Zoom is the audience. We've never had more participation, even at the committee level, because of people not having to run to Hartford. So, you know, just kind of my thoughts for you guys going forward. Gemma and I did talk about having a meeting with Doriana and some others to kind of just talk about the structure going into next year. And Lisa is still going to be our administrator, which will be great for you guys because you'll still have that consistency that you've had right along. But it's, again, just been my pleasure to work with all of you. I wish you all the best and the luck, best of luck, sorry, in the future. And if there are no other questions or comments, we will adjourn this Autism Advisory Council.
Thank you, Kathy.
Thanks, guys.
Thank you.
Have a
Thank
great
you.
day.
Thank you, Kathy.
Thanks, everyone.
Thank you, Kathy.
It's been a pleasure.
Thank you, Kathy.
Thank you.
Bye-bye.
Bye, guys.